I am a teenage girl attending a private bilingual school in Berkeley, California. As I've started to become more of my privilege, I've started to realize how fortunate I am to live in a place like the Bay Area where it has never been an issue to get the care I need. We have a certain amount of privilege. Most of us probably see our doctor regularly, but 27 million people in the U.S. don't have the insurance to pay for that doctor's visit. And if you dig deeper, 341 million people in the U.S. are in debt, and America's population owes an estimated $220 billion in medical debt. As people put off their monthly to annual appointments, all of this time accumulated without seeing a doctor or medical professional can lead to many emergencies and, in certain cases, death. Healthcare is a vast and complex problem, but today I'm going to focus my talk on geographic accessibility for healthcare in the U.S. The rural U.S. population faces transportation barriers due to where they live. A rural area comprises open country with settlements with fewer than 5,000 residents and fewer than 2,000 housing units. Residents in these areas are prone to encountering barriers to care, which limit their ability to obtain the resources that they need. People living in more urban areas have many different advantages simply because of where they live. In these city areas, there's generally more accessibility to medical services. An estimated 60 million people in the U.S. live in rural areas and are being affected daily by a lack of access to care. For example, specific services like rehabilitation and substance abuse facilities are much harder to access in these communities. An approximate 31% of all admitted individuals receive treatment in urban areas, whereas only a slim 7% receive that same exact treatment but in rural areas. The question is, why is this happening and who is it affecting? According to Oregon Health and Science University, over 2 million women of childbearing age live in maternity care deserts, meaning that the county has no hospitals, obstetric centers, or providers. And over 120 rural hospitals have closed since 2010. The ones that have remained open are financially vulnerable and rapidly shutting down their obstetric centers, leaving over half of all rural U.S. counties without maternity service. American journalist Monica Potts shares the challenges of pregnancy decisions in her community. In her memoir, The Forgotten Girls, a memoir of friendship and lost promise, she highlights the difference between rural and urban life, particularly how women often lack access to contraception in clinics. In her small hometown of Clinton, Arkansas, women often struggle to get out of the loop of motherhood. As Potts points out, our lives were shaped by our behavior, but also by the places where we lived. Returning to Clinton after college, she discovers her former childhood best friend, Darcy, as a struggling single mother of two who turned to drugs and alcohol, far from the dreams they both once shared. As Monica had envisioned a completely different future for Darcy, Darcy's options in closed-minded town confined her, perfectly demonstrating that where you live and what you have access to can greatly diminish both a person and their health. There are things that we, as a country, can do to help advance the healthcare world. Telehealth can be a great alternative to in-person checkups, appointments, and general care. Telehealth is a concept of using online communication and electronic information to give support and care to our long-distance patients. For a lot of people, this option offers more convenience, flexibility, and comfort, and we see this especially with our rural residents. Instead of them having to travel somewhere to get the care that they need, they can manage the tools online and access their health without the struggle of getting to a specific location quickly and safely. Creating access in needed areas can not only save lives, but lead to innovation for our future. It doesn't only have to be an in-person checkup. Online appointments and mobile clinics can bring these services closer to people's homes. But there tends to be a hidden cost when it comes to healthcare. And for a lot of people, this can come in many different shapes and forms, whether that's financial, geographic, or discriminatory. But what our goal should be is for everyone to get into a hospital or clinic and get the care that they need without that hidden cost even crossing their mind. Healthcare is better for the community because we all deserve it. Join me in advocating for those without accessible medical care. It is never enough to just hear and listen, but also to speak out in support. Sharing your knowledge and supporting laws and organizations that help promote and develop innovation for accessible medical care can go a long way. You never know the silent battles people are facing. You never know how much your actions could be impacting someone's life. Thank you.